Thanks, Brandis. As Amanda reported, the turmoil at Chicago Public Schools will go on tomorrow as CPS and the CTU remain at odds over holding in-person classes. A short time ago, I spoke with Mayor Lightfoot about the situation. I began by asking her how many schools will be able to open with staff tomorrow.
Well, I don't think we're going to know that sitting here today. But what we saw from yesterday to today is a uptick in the number of personnel that are reporting to schools. We definitely have some schools that are fully open, others that are at various degrees. But we obviously want to make sure that we have sufficient number of staff, not only to teach, but to keep kids safe. So we're working on improving those numbers on a day-by-day basis.
And is CPS any closer to CTU in terms of agreeing on issues like testing, vaccination, masks, and metrics for closing down classrooms?
Well, look, we put a proposal on the table on Tuesday before the CTU vote for metrics regarding either transitioning classrooms or whole schools to remote if there were virus numbers that were troubling. We're still waiting to get a substantive response back from the CTU. We have a framework for more testing, and we're not going to wait to whether or not it's agreed upon, but we're going to put together a very specific proposal and put on the table. But meanwhile, there's testing that's available at local schools. And importantly, we really want to encourage our families to get their children vaccinated. That is really the answer to a lot of these challenges. If we can substantially improve the vaccination rate among CPS students, we will have accomplished a lot. And we don't need to wait for that. There's plenty of vaccine available. There's a vaccine available at schools. There's vaccine available in FQACs, in other neighborhoods and pharmacies. So we really want parents to take advantage of this downtime and get their children vaccinated.
At the same time, CPS is saying they want mandatory testing. As you know, they want parents having the ability to opt out. You want parents to have to give permission to opt in. Is there any middle ground on that?
Look, I think there can be a middle ground, but I'm very uncomfortable with the notion when we've only got a small percentage of parents who have opted in that we're going to go against the wishes of the majority of parents who haven't opted in. That makes me very uncomfortable as a parent. It makes me concerned about potential liability. So we've got to reach some common ground there. I think we can, but saying that we're going to go, if parents don't give us an affirmative no, that we're going to impose a quasi-medical procedure on their children without their knowledge and consent, I just can't agree to that. But we can reach some middle ground here, but it can't be their way or no way.
You're saying there's a proposal you're working on. When is that going to be presented?
No, what I'm saying is that that we can reach a middle ground. We should be doing that at the bargaining table. I think there's ways that we can work to improve the number of parents who have affirmatively consented, and I'd love to work with CTU on that. But there's a lot of things we can reach common ground on. But when they go to the nuclear option and go and an illegal strike, it makes working together so much more challenging.
And it's noted that CTU does not have the power to unilaterally decide that they're going to teach remotely, but given the current reality that that's where teachers are, would you be open to allowing remote instruction in the interim?
Well, look, we have had remote instruction where it's needed throughout the course of the school year. That has been a thing. But what I don't think is appropriate, and because the science and the data don't dictate it, is shutting down an entire school system as they've done. They are absolutely in an illegal work stoppage, an illegal strike. And unfortunately, because they've taken this action, teachers who do not report to work and do their job are not getting paid.
You say illegal work stoppage, illegal strike. You filed a complaint with the Education and Labor Relations Board. Does that mean you might go to court like you did with the FOP over vaccinations?
Well, we're looking at other legal options, but the best thing for our kids and our parents is to reach some resolution, get students back in the classroom, and move forward. Legal action obviously is always an option, but the best option is to work collaboratively, but get kids back in school because the schools are safe. That's the safest place for them to be. And that's the best place where they can learn in a nurturing environment. Keep in mind, Paris, our kids depend upon our schools for much more than just learning their ABCs or math. They depend upon schools for food, for medicine, for a lot of assistance that is necessary for some of our students, particularly our special needs students. And we are doing a disservice to those kids and the families that depend upon those schools every day. I'm worried about parents who are now stuck between a rock and a hard place and not able to either work or homeschool. And that Hobsonian choice shouldn't be there. CTU should not have put them in this position.
Widespread acceptance that remote learning is not a good option right now overall for students, but you know, you say schools are the safest place. The state of Illinois just plowed past its daily record for COVID cases. Hospitalizations are setting a record, including child hospitalizations. So can you at least sympathize with parents that say, wait a second, maybe we don't want our kids in school right now. Maybe we want to pause.
Look, it's not that I don't sympathize. I do. I understand it. No one knows these numbers better than I do. No one has experienced this. We've been at this for almost 2 years. This is really hard, difficult stuff. It's a very concerning time. But why I say that schools are safe is a number of things. $100 million in retrofits to make sure that we've improved ventilation, that we've improved the quality of classrooms, that we put air filters in, that we put partitions in, we put masks, hand sanitizer, we stood up school safety committees. And when you adhere to those safety guidelines, those mitigation guidelines with fidelity, and our children are social distancing in classroom with masks, that is the safest place for them to be to learn.
Although the teachers union is saying there's not enough masks, obviously not enough tests.
No. There's plenty of masks. We have purchased the hundreds of thousands of masks. We just pushed 200,000 masks into CPS just this week. The masks are not the problem. The problem is we've got to get more children vaccinated, but putting them at risk out in the community where community spread is high, not allowing them to be in person in schools, that heightens the risk. It doesn't lower the risk. If you've listened to anything that Dr. Arwady and her team have been saying about the actual experience of CPS over the course of this school year, we've had 50 cases that CDPH has identified as clusters, and many of them were occasioned by things that happened outside of the school coming into the school. So Mayor, our schools are safe.
Mayor, I mean, it's clear this is an emergency. Kids do need to be in school or at least learning. Have you heard from the governor on this at all? We haven't. And the President of the United States is on your side too. Is there assistance from the White House possibly on this?
Look, we have been talking to the White House, and I've had multiple conversations with the governor. I don't have any concerns about their support whatsoever, but this is an issue that's got to be solved at the bargaining table between CPS and the CTU. And they all understand that, but they also understand that the safest place for our kids to be is in schools and in-person learning.
All right, Mayor Lori Lightfoot, we thank you for joining us. We appreciate it.
My pleasure, Paris.